Alright, so our next wound infection is actually going to be called actinomycosis. Its common name is lumpy jaw. Now, it was originally considered to be a fungal disease, which is why you have mycosis in the name. However, it is not caused by a fungus. This disease is slowly progressive. You can get these painful swellings that are under the skin that will burst and drain pus. The openings typically will heal and then reappear days or weeks later. They are usually on the jaw or the neck, thus the name, but sometimes they can be on the chest, the abdominal wall, or in the genitalial tract of women. The causative agent is usually Actinomyces israeli. It is a gram-positive, filamentous, branching, anaerobic bacteria that's very slow growing. We're still working on the pathogenesis of this. We know it cannot penetrate the normal mucosal surface, but it can establish infections with other members of the normal microbiota if it's introduced into wounds. You get these alternating cycles of abscess formation and healing, and it will create these yellowish colonies that are diagnostic when it grows in culture. They're called sulfur granules because they actually look like particles of sulfur. Now, this can be part of the normal microbiota of the mouth, the upper respiratory tract, the intestines, and sometimes the vagina. Getting actinomycosis in the pelvic area can actually complicate the use of IUDs in some women. This is very sporadic. It is not transmitted person to person. Because it grows slowly and in dense colonies, you need to give antibacterial medications for extended periods of time because you have limited diffusion of the medication to the bacteria. Now, you also have bite wounds. There's more than 3 million animal bites that occur in the U.S. annually, and your infection risks are going to be determined by the type of bite. Was it a crushing bite? Was it a laceration? Was it a puncture? What pathogens were in the mouth of the animal? You're also going to find people get bit by other humans. And this can result in serious infections, and you can actually see things like syphilis, TB, and hepatitis being transmitted. Typically with a bite, the wound's going to appear minor at first, but then it's going to become painful, it's going to swell, it's going to leak smelly pus, and there's a whole lot of species that can do this. So you're going to find that bite wounds can be infected with both aerobic and anaerobic species. Whether or not they're aerobic or anaerobic is going to depend on how much tissue, if any, is crushed. The issue is that these bacteria by themselves are usually not a big deal, but working together, and because you have this damage, it can actually cause these synergistic infections. You're going to find that bite wounds often come from fights that occur when you're drinking, when you're restraining people, and a lot of times from children who don't know better. And poor mouth hygiene increases the risk. So typically, if you get bit by another person, you should treat the wound immediately to avoid infection. Depending on the situation, like if you get in a drunken bar fight and someone bites you, you're going to want to go to the hospital so that they can clean the wound. They might have to open it further to clean it better. You want to remove any dirt, foreign matter, dead tissue. You want to take antimicrobial medications. You basically want to avoid situations where people are going to bite you or hit you. And you want to clean the wound immediately. Now, you also have Pasteurella multocida bite wound infections. These can be caused by a number of different animals. So you have this redness and tenderness at the site of the bite. Then you will have a swelling of tissue, pus discharge, and then abscesses can form. If you don't have treatment fast enough, this can actually lead to the bacteria invading the bloodstream and permanent loss of function. So Pasteurella multocida is a gram-negative, facultative anaerobic coccobacillus. They do actually produce these anti-phagocytic capsules so that they're not phagocytized by macrophages. Some strains do seem to produce toxins that can mess with protein synthesis and the cell cycle. You're going to find that humans and animals carry this as part of their normal microbiota. However, cats are more likely to carry it than dogs. It is susceptible to penicillin, but you do generally give beta-lactamase inhibitors because you're going to find that a lot of bite wounds do have Staph aureus that produces beta-lactamase. There is no vaccine. Basically, you want to clean wounds and get prompt medical attention. You have Barthellosis, cat scratch disease. So basically, you're going to get this pus-filled pimple that's going to appear within a week of a scratch or a bite. Within 2 months, the lymph nodes were closest to where the bite was are going to enlarge painfully. You may develop a fever. You can actually have pus filling the lymph nodes, but this typically goes away in 2 to 4 months, even without treatment. The causative agent here is Bartonella henselae. It is a curved gram-negative rod. We don't really understand its virulence factors or the process of disease spread. We do know it tends to come from cats biting or scratching, or from cat saliva. So this occurs worldwide, typically in children and young adults, and it is considered a zoonosis of cats. You do not have person-to-person spread, but it can be spread cat to cat by fleas. Fleas may be able to pass it to humans. Now, why is this more commonly seen in children and young adults? Behavior. If you're a little kid and you see a cat, you're going to pet it. You don't care that the cat is hissing at you or its hair goes up because you want to pet the kitty. As adults, we've experienced enough angry cats that we know if the cat does not want to be touched, you don't touch the cat. That's why this is more common in younger individuals. Now, treatment and prevention, basically you clean a scratch or a bite and you put on a topical antiseptic. If you have a severe infection, you will have to go to the doctor. You get put on something like ampicillin. Basically, you try to stay away from stray cats. Don't pet cats that don't want to be pet. Avoid fleas and get flea treatment for your own animals. We have rat bite fever. Typically, if you get bit by a rat, it's going to heal promptly. You're not going to see that wound long term. A few days later, you're going to have chills, fever, head and muscle aches, vomiting, and the fever is going to come and go. The rash will take a few days to develop, and then you're going to have joint pain. The causative agent here is Streptobacillus monoileiformis. It is a facultative anaerobe. It is a gram-negative pleomorphic rod. What does pleomorphic mean again? Let's end that dramatic pause. It means that it's capable of growing in different shapes depending on conditions, and it can actually develop forms that do not have a cell wall. It will typically enter through a bite or scratch, sometimes ingestion of rodent meat. Don't make a face. In some countries, eating things like guinea pigs are considered a delicacy, so realize that this can be transmitted from eating rodents. The recovery usually occurs in about 2 weeks, but it can be rapidly fatal. So most rodents carry this in their nose and throat. You're going to find that rat bites are common in poor and large cities, also in those who work in labs with rodents and those who work in pet stores. You'll also find that epidemics have occurred following consumption of food and liquid that's been contaminated by rodent feces. Typically, you have to give penicillin intravenously, and prevention includes basically controlling rodent populations and being careful when you handle rats and in labs as well as their feces. Now, you can also have some fungal wound infections. These are usually more serious than cutaneous mycoses because you have fungi entering wounds. So the first one we have is sporotrichosis, which is Rose Gardner's disease. You have a wound site on a hand, an arm, a leg, maybe the trunk of your body, and you get these chronic ulcers that form, followed by these ulcerating nodules. They move towards the center of the body. Your lymph nodes will enlarge, but you do not become severely ill unless you're immune compromised. The causative agent here is Sporothrix schnecki. It is a dimorphic fungus that lives in soil and on vegetation. Basically, you injure yourself working with a plant, and the fungal spores enter your body. You have this pimple that forms that then enlarges and ulcerates, and then this keeps repeating. Now, what's interesting is you will see these ulcerations growing towards your the closest lymph node, they will not proceed past that lymph node. So if it happens on, like, say your right hand, it'll move towards the lymph nodes in your armpit on the right side, and then it won't pass that point. You will continue to have lesions form over time. It can become chronic and last for years without treatment. This is found worldwide, mostly in warmer climates, and it's an occupational risk of, gardeners, basically. So typically you'll cure this by taking potassium iodide. For some reason, it enhances the body's ability to fight the fungus. There are some other medications that can be taken, but basically you prevent this by wearing protective gloves and clothing when you're working with plants. And that is what we have for wound infections.